Every 7 minutes, somewhere in the world, a woman dies from a complication of pregnancy. Pregnancy requires a delicate balance where your blood must clot well enough to protect and prevent excessive bleeding, especially during delivery, but not so much that it forms dangerous clots. Now, a classic example of situation where this delicate balance is dysregulated is preeclampsia. Now, in simple terms, preeclampsia is a hypertensive complication of pregnancy. That is, there's elevated blood pressure in pregnancy. And this affects 8% of pregnancy worldwide and accounts for 70,000 maternal deaths every year. 70,000. Now, that is not even the scary part. The scary part is we don't exactly, or science doesn't exactly understand why this develops, or even a good way to predict it so that we know who is at risk of developing it and who is not. And this is where my research comes in, where I'll be studying a protein called PSG1, that is pregnancy-specific glycoprotein. It is a placental protein secreted exclusively and only seen in a woman's body during pregnancy. Now, we found out, or my study is based off of the findings, that PSG1 actually is taken up by platelets. For context, platelets are tiny cells in our blood that play a key role in clotting. Think of every time you have an injury, you're bleeding, and suddenly you stop bleeding. That is platelets at work. It is what is responsible to stop bleeding during injury or when there's vascular damage. Now, we found out that PSG1, or platelets, actually pick up this PSG1. And even what's more fascinating is that preeclampsia pregnancy pick up a higher concentration of this PSG1. That is what my study is based off of, because of this novel finding that platelets actually pick up PSG1. So I'll be studying what is the function. We know that it already picks it up. How does it modulate? What is this function in platelets? How does it modulate platelets function? What does it do? It's picked up, right? But what does it do? So that is what my study is all about. And it's not just about studying PSG1 and platelets, but it's all about protecting a woman. But it's all about protecting a woman and the baby, because every mother is supposed to meet her baby safely. And this is what keeps me in the lab every day. If we're able to understand exactly how PSG1 interacts with platelets and what it does, we could be able to predict who is at risk of developing preeclampsia and who is not at risk. And this is what my research is all about. Thank you.
Questions?
Yeah, sure.
Is there a genetic component to preeclampsia, or is it primarily environmentally determined?
So not just environmentally determined. They are like, first is that genetics actually play a role. So if there's a history of that, or you've developed preeclampsia before, there's also higher chances that you could do that. There are also environmental factors such as obesity and age that could play a role in that, but that is so much that is known about it besides that. Not that much.
Thank you.